This is our guest today is Dr. Tolu Oko-Igaire. I hope I said that right.
You tried.
Yeah, okay. And she's one of Africa's foremost sex therapists and professional mental health practitioner, a clinical counselor with demonstrated experience in depression treatment, PTSD counselling, human sexuality, and dysfunctional behavioral treatment. Also a leading Gestalt, CBT, and Psychodynamic as expert with specialization in personality disorder, sexual dysfunction, and family dynamics. Dr. Tolu, in an environment where professional counseling is non-existent and discussing mental and sexual health issues considered a taboo, single-handedly took mental health counseling and psychotherapy from the backward traditional level to a more professional forefront, blending counseling skills and ethical values. She is the president of the Association for Counseling, Matchmaking and Psychotherapy of Nigeria, ACMPN, and members of numerous international counseling and psychotherapy organizations. She is also executive director of the Institute of Counseling in Nigeria. So this is a lady that we say the Oga at the top, basically. She is, even myself in my counseling training, she's my Oga. So basically, let's put it out there. So welcome, Dr. Tolu. Welcome, welcome, welcome. Firstly, I wanted to ask you this question. Why are you called the fixer? Everybody wants to know. The fixer.
Thank you, KG, for having me. And well done, for all you've been doing, of course, in this field of counseling and mental wellness. I see all you do, and of course, I'm proud of you, right? So why am I called the fixer? Because I fix. I'm a fixer because I normally say I build homes, I mend relationship, and I fix sexual issues. So maybe literally speaking, we know that counselors are not, you are not under obligation to solve people's problem. But I mean, in a simple way, I call myself the fixer in a way that people can understand that, you know what, it can always be fixed, it can always be worked on. And I really do not believe there's any relationship or marriage or sex life that cannot be fixed, as long as the parties involved are willing to make it work. And of course, I've helped a lot of people. I have helped a lot of people, singles, couples, married individuals, with a sexual relationship, mental health issues. So I believe it can be fixed, and I've been fixing it, and that's why I'm the fixer.
Oh, fantastic. And I just wanted you to tell us a little bit about yourself, because, I know you, but people want to know who you are. So if you just let us know a little bit about you.
Okay. Where do I start from? I would just say, whatever comes to mind. Of course, like you have said earlier, I'm the executive director of the Institute of Counselling in Nigeria. I'm the current president of the Association for Counseling and Psychotherapy of Nigeria. If you have listened to me speak, or whether in my class or in a seminar like this, you will understand how passionate I am. I normally say you can touch my passion. I'm very passionate because, I see these things and I feel like the troubles are so many, and who is going to help us if we don't arise, as individuals, to do something about the state of mental health of especially people in Nigeria and Africa as a whole. And I remember when I started this, this mental health crusade, like I normally call it, some of my friends then, say like 15 years ago, were asking me like, Tolu, what is this thing again that you are doing? What is this? Well, a lot of people have no understanding. And I remember when I started talking about sex, I remember my pastor then called me and asked me, Sister Tolu, are you still born again? What it also, because, I have a radio show, and it was like, what is all these things that you're talking about on radio? Talk about sex anyhow. Are you sure you are still on the Lord's side and all of that? But for me, while I was growing up, while I was in primary school, I've always been like a problem solver, you know, from primary to secondary to the universities. My friend in the university could testify to the fact that when they have problem, they always have this, you know, talk among themselves of let Tolu comes. You know, if Tolu comes, she'll help us to resolve the problem. So I've always been like that. And, you know, I've always been a church girl all my life. And if I tell people I've been a church girl, like, I mean, I grew up in church, in deeper life, you know, deeper life of those days where you don't even wear jewelries, where you don't wear trousers. And then the way I talk about sex, a lot of people, you know how religion is in this part of the world. A lot of people feel like, woo, this one, you know, is not born again and all of that. But of course, I understand the professional aspect of what I do, and I understand the place of, you know, what I call the conspiracy of silence, the hypocrisy in this part of the world, the fact that people are dying in silence, people are going through a lot, but they would rather come out and act like everything is fine, you know, just because you want people to think you have it all well put together. So I noticed all of these things, and I was restless, you know. So that has always been me. I mean, I'm a woman of I mean, I do a lot and I do them effortlessly. Because I enjoy what I do. And that is why I tell people your passion is attached to your mental health, you know, because when you are doing what you are called to do, you find a kind of fulfillment, a kind of strength that might be difficult for you to get in other places. Maybe you are in a different profession, you know, but when you are, if you start living, immediately you find your calling. A lot of people are just existing, you know, roaming around. It's not about making money. Money is good, right? In fact, if you find your passion and you stick to it, money is going to come. But for the sake of your mental health, for living life to the fullest, a fulfilled life, for, you know, living a stress, you know, even if I'm stressed, you know, maybe because it's mental health, I understand how to balance, you know, my mental health and my job, the stress part of it, I understand how to do all of that. But even if I'm stressed, I find strength in what, and that is why I always encourage people to find that there is something about you that the whole world is waiting for. There is something you have to make the world a better place. And it's not, you are not going to be pretty. You know, some of the core skills of a skilled helper is genuineness. So you are not pretending about it. You are not trying to, you know, make people feel good. That's why you are doing it. It's in you. You want it to, you are genuine. You are passionate about people. When you go on like that, you notice that the money aspect will come. It flows effortlessly for you. And of course, I'm not where I am today. I was very far from there. I'm a product of, you know, self-improvement. I wasn't I wasn't this. I mean, of course, I'm not there yet, but I'm far away from where I was coming from. So I'm a product of self-development. I'm a product of, I don't care what anybody think or say. When I catch that bug, normally I say to people, and I say that a lot during our classes at the Institute of Counselling, that, you know what, it's not everybody that is going to catch the bug. When I catch it, you know, so when I know this is what I'm called to do, and I set my eyes on it, nothing is going to, nobody, there's nothing anybody could say, you know, and then people will say a lot to you. People are going to make you feel capable. People are going to distract you. People are going to, how is that your business? And again, in the field of mental health, you know, you have a lot of understanding about how human mind works. Yes. And that helps you to understand people are entitled to their opinion. Your information is coming, you know, your probably your opinion or your reaction is coming from the level of information that is available to you. So you don't even have all the information about me. So why should I be bothered, or why should I be moved, or why should I allow what you think or feel affect me? And I said this to a lot of women. Of course, for me, I have a very supportive husband. He has always been there from day one. But having said that, he's still an African man who also believe that, you know what, whatever you want, I can give to you. Whatever you need, I can give to you. But for me, it is not about money. It is about passion. And that is why I tell women that feel like, you know what, oh, my husband will not allow me to work. Oh, this is my problem. I tell them, come on, I understand it's possible. But if your passion is strong enough, nobody, especially for women, because your passion, your like I said, your mental health will be attached to your passion, your happiness, your fulfillment. Happy wife, happy life. So if a man wants a happy wife, he will just allow your happiness is connected to your passion. He will have no option. So I've been through a journey of self-development. Some of my friends that, you know, that we grew up together, when they see me today, some of them like, I mean, I remember I saw a friend recently say, is that Tolu? And I look at it and I'm like, what is she saying? Do you understand? So I am a product of self-development, and I'm a product of keying into my passion, and I'm a product of believing nothing impossible, and there is nobody that can stop you. You are the only one that can stop yourself. I don't know if that helps.
Yes, I really love that. I really love that so much. You know, that encouragement to just keep going. You know, like you said, it's taking years of you actually investing in yourself, you know, for you to get to where you are today. So somebody might see you and say, oh, look at her, but they don't realize the effort and the sweat and everything that you put into it. So we're really grateful to have you. Really grateful to have you. So we're going to go into the discussion, and the first question I have for you is this: does intimacy start in the bedroom? You know, yes.
So the answer, of course, is simple: is a no. Right? So there is what I call, the 4 points of connectivity. Yeah, the point of waking up, the point of saying goodbye, the point of saying welcome, and the point of saying good night. How do you normally wake up? Do you just wake up from the bed and then, you know, that is even if you are sharing a room. So even if you are not sharing a room, but if you are sharing a bed, for example, do you just wake up, roll up from the bed, and then stand up and then rush to the bathroom? What will it cost you to look at your partner and say, and maybe if she's a woman, you can just look at her. In seconds, you can do that. And then give her a peck. Oh, sleeping beauty. You know, you just say that. And then, you know, imagine a woman, maybe on bed, and somebody, your husband or somebody you care about, just pecked you and says, sleepy, sleepy, sleepy beauty. And then pat you and give you a peck in the head and then walk to the bathroom or something. Imagine what you are feeling. The point of waking up. You can roll over to the bed, to the other side of the bed if you are the first one to wake up, and just plant a kiss on the partner's lip. It doesn't have to be a French kiss. If the two of you are waking up together, you could give yourself a hug. Good morning, baby. How was your night? For so many of us, we just wake up. You wake up on your own. I wake up on my own, and everybody just moved on. It's not supposed to be so. The point of waking up. How do you wake up? How do you look at yourself? You could be, even your partner might not be aware that you are awake. And then you can just look at them and say, oh, I feel so blessed to have this man. I feel so blessed to have this woman. Imagine a woman turning, you know, on the bed and waking up to that kind of a thing, or a man turning on the bed and waking up to that. Then the point of saying goodbye. I said this a lot of time. If you can have like a French kiss when you are about leaving the house, you know, you can have a French kiss, a very deep French kiss with your partner. It won't take more than 2 minutes. That kiss could carry them for the rest of the day. They could keep thinking about it for the rest of the day. You know, send a lot of feel-good hormones to their system for the rest of the day. Then the point of even welcome, and why you at work, how you doing, sending lunch, you know, these are little things, these are intimacy. Sending lunch across with a simple note. It's not even, it doesn't have to be a lot of money. It's the thought. These are the things that build intimacy. The way you welcome yourself you come back from work, you know, is it that you just walk in and drop your bag and go your own, and this one, you know, rush to the kitchen? There's nothing like a hug. Oh, baby, welcome. How was work today? You know, this is for those that are married. And for those that are not married, how do you take care of, you know, little things that can't? You know, I tell people that we know for Africans, we are so particular about money. But the beautiful things of life are not necessarily bought with money. A little hello, a little how you doing, a little peck, you know, a peck on the neck when she wasn't expecting it, a little hug from the back. You know, a hug from the back is a lot for women. I really do not know if our men knows about that. You know, giving her a hug from the back is a lot, especially when she's not expecting it. Just hug her from the back and plant a kiss on the neck. You know, just had the intimacy. You know, a little bit of touch. You know, when you are walking past each other, you can grab the ass. It's a lot for women. You can, you know, do a little bit of touch. There's no way. Even says you cannot, you know, touch the man's penis when he wasn't expecting it. You can just touch and then just walk back and smile, give a funny face. Those are intimacy, not because you want to have sex. Those are intimacy. Understanding, you know, they call it love language, but for me, I don't like the word love language because I feel people are just bastardizing it, and you know, but just understanding the little things that count. That is intimacy. Being able to touch it, you know, when you are not expecting to have sex, being able to send, you know, love notes to each other, being concerned about other people's emotion, taking care of what, you know, investing emotionally. These are intimacy. Intimacy is not, intimacy could be sexual, it could be intellectual, it could be emotional, it could be verbal. You know, so sexual intimacy is just one part of intimacy. So, but if we are even talking about sexual intimacy, it goes beyond the bedroom. Majority, in fact, I normally say that 90% of intimacy happen outside the bedroom.
Can you hear me?
Yes, I can.
Okay, yeah, yes. Fantastic.
Right.
Okay, yeah.
So I hope that answers the question. So the question says,
yeah.
Intimacy about sex?
Yes. So because I wanted to go into the next question, which, you know, because sometimes it's in the mind, it's a mindset thing. So
Yeah.
how does the role of our understanding, particularly if you grew up in certain culture or you belong to certain groups of beliefs, that people tend to they see sex as separate. It's this thing there is not part of this. So whenever they want to approach, you know, that aspect of their life, they feel like an imposter, really, like an imposter syndrome. I don't really want to go there. I don't really feel comfortable. How important is our mindset, changing our mind about sex and how we can have sexual intimacy in our relationship? How important is it? And how can people that are stuck in that place, you know, I'm saying this because, you know, I know that, you know, some, particularly if you've grown up in a church for a very long time, you know, sex is like, okay, yeah, you know, don't go there. Only think about it on your wedding night, and that's the end of it. And then when people get into relationship or they get into intimate relationship, they find it very hard to connect.
Right. So currently, my research work for my PhD in sexology is toxic masculinity, the cause of erectile dysfunction in African men. So you can relate this together. You see, toxic masculinity, it's more of what you are trying to talk about in men, and then I will talk about it in female. You know, this thing, and it's very peculiar to African. You know, this thing about if you are a man, you should, I mean, control is huge for African men. So they should have everything well put together. They should be able to last for certain hours, you know, when making love or when having sex. They should be able to make a woman feel in a certain way, right? Which they don't even understand, right? What they even, so I feel like a lot of African men are clueless, I'm sorry to say, when it comes to what even make a woman to enjoy sex. So for them, it is more about how long can I last? How many rounds can I go? You are lasting 1 hour, you are going so many rounds. What the woman is having is bruises, is pain, and she's not even enjoying it. And for you, as soon as the woman complain like, oh baby, I'm not just, maybe can we try this way? Then you start feeling incapable, because control is huge for you. You start feeling incapable. You start feeling like, oh, I'm not good enough, just because she tried to explain to you that, you know what, I don't think I'm enjoying this thing. Can you do it? It becomes a problem for you. And that is why you see our women are quiet. They don't want to talk anymore. So they are there. A lot of them have learned what I call learned helplessness. So they are just there. They are rigid. They are frigid. And they cannot, you know, because I said this, you know, love making for women is like pushing a car up a cliff. So for example, let's say this is a cliff, you know, it's in a slant position, and you want to push maybe a car or a very heavy load. You know, when you are pushing, you need to, I mean, you need to put a lot of energy, a lot of force, a lot of strength. And for women, it could be a lot of mental energy. You know what? I just want to enjoy this. I just want to get there. I just want to make sure everything is all right. So she's coming. And then she's coming and she's coming and she's coming. And she gets there. She's trying. And then you touch the nipple wrongly. And then she comes back. And then she's trying to come back again. She's coming. Oh, you know what? I just need to reach orgasm today. And she's coming. And then you touch the clitoris wrongly. And she's there. So she keeps struggling to enjoy this thing, to get to the peak. You know, and she know, you know, there's a way that things make you feel like, you know what, I need to get something. It's more like, oh, I'm coming. And then you are down. After some time, you know, come, go, you are coming, you go back down, you are coming. You just stay there. You learn helplessness. So for a lot of women, this is where they are, because they cannot open up and tell the man, you know what, I'm not enjoying it. Because when you say that to the woman, to the man, it becomes a problem. And then for so many of us as women, what we just do is just learn helplessness, or just stay there, believe that I cannot enjoy sex. Meanwhile, women have the capacity to enjoy sex more than men, but because we have been conditioned wrongly, the same way the men are conditioned that, you know, the control is huge for them. And as soon as the woman complains, they start struggling with their erection because they feel like they are losing control. And it leads to erectile dysfunction. And then for the women, you know, when you were growing up, everything they keep telling you was, oh, sex is, you know, for so many of us that were celibates, a lot of, or those that are at least trying to avoid having sex, a lot of them pack a lot of baggages in their head. Oh, sex is bad, sex is terrible, sex is this, sex is that, you know, so just to condition, you know, themselves to be able to avoid sex when they do not want to. Now, because, I mean, you remember when you talk about cognitive therapy, it takes longer period of time. It's like installing a software. So you keep putting it there, you keep putting it there. After some time, it's formed. The brain is formed, it's no longer plastic. All the information has been stored. And then now you are ready to have sex after marriage. And then you think it's a switch that you're going to put on, off. No way. You have to start reconditioning your brain. And that is a major problem with a lot of African women. For so many, like I said, they have learned helplessness. For a lot of people, it's more like, you know what? Sex is not a good thing. So you cannot even enjoy it. And unfortunately, you don't even have a man that have understanding of how female sexuality works, who know how to touch you, how to warm you up gradually. So you don't want to know the number of couples that I have seen. People who are married, I have seen you know, and this is very common with the church folks, very religious folks, married for 2 years and not able to penetrate. So I have seen 1 month, 3 months, 6 months, but the most outrageous was 2 years.
Wow.
And then you're telling this person, you know what, you need to come for therapy, because we need to do a lot of, you know, reconditioning, even for the two of you. Because by the time you psychoanalyze, you understand that this person says, I kept telling myself I cannot have sex, I kept suppressing it. You suppress it. These are hormones. These are right things. These are the way your body want to grow. There are ways you are supposed to grow. Remember the stages of psychosexual development. So there are ways you're supposed to grow sexually, from, you know, infants to early childhood, to late childhood, to adolescence. There are ways you're supposed to grow sexually, because you're a sexual being. So you utter all those stages of growth. You condition yourself, you know, the wrong way sexually, and then you are ready to have sex. You are going to struggle. And that is a lot of couples are struggling in this part of the world, especially Africans, you know, struggling because we see sex as a taboo, see sex as, I mean, a lot of wrong informations that are packed in our brain.
Deep.
Yeah, deep.
Very deep. I just, yeah. There's a lot going through my mind as you're talking right now. So now, for a woman to know what she wants, okay, what advice would you give to her, or what tips would you give to her, number one, about having the confidence to speak about what she wants in a relationship, and how she wants to feel, and how she wants to be touched, how she wants to be caressed, how she wants to be handled sexually? What tips would you give to her to be able to have the confidence to speak about it? And how can she spice things up if she feels like things are a little bit, you know, not on the level that she doesn't want it to be? How can she spice it up?
So I'm going to answer it in two ways. It's the first point is not as easy as it sounds, because, like I said, this person has been conditioned.
Yeah.
She doesn't have the capacity. In fact, she doesn't even know what she wants in a lot of cases. She doesn't know what works for her. She doesn't know her sensitive spots in her body. And then she expects the man to be a magician to locate those places. So it's a bit complicated, because you do not understand yourself. How do you even explain it to the other person? And then apart from that, now, if you now understand yourself, that is the second phase. Now telling the other person becomes difficult, because you have been conditioned.
Yes.
It's more,
yeah.
I call it conspiracy of silence. It's difficult for a lot of people to discuss sex with their partner. And for people who might, you know, maybe struggle, tried, and then open up and say, babe, can you touch me like this? And then you see the man asking, where did you learn that from? Where is that one coming from? So for a lot of women, they will tell you, my husband will ask me, where did I see that from? I mean, I see that a lot of time where they ask me, tell him. If you cannot tell him, take his hand, put it there. And if he's touching you somehow, tell him, can you do it like this? If he's touching your clitoris like he's turning the knob of this old school radio, take the finger and tell him, you know what, that is not the right way to touch it. And just say, baby, you know, can you hold his finger and say, baby, can you touch it like this? The clitoris is not like, it's so sensitive. It's made up of about 8,000 nerve endings. So it's not what you know, for some men, how do we even learn how to do all of this? For a lot of people, it's from porn. And then they feel like, you know, and then, or maybe they are sitting among themselves where they are, you know, sitting with the boys in the evening. And then you see them saying, I don't know what to do. I've been, you know, that my babe, I've been trying to touch and it's not working. And they like, and you see the friend saying, have you touched the clitoris? Touch the clitoris now. And that's all he knows. Touch the clitoris. And when he got home, he just feel like, oh, they say I should touch the clitoris. And then you start touching the clitoris. Like, I don't know if KG know if you know all this old school radio, you know, and then you so you can imagine. So it's so number one, you don't even understand yourself. That's the first phase of the problem. Number two, you can't now, even now, if you now understand yourself, you cannot express yourself. Because I mean, I said this, you know, I think this is more like patriarchy or African. Because I normally feel like while you were growing up, think about it. Your forefathers have plenty wives. So imagine a man that have like 10 wives, for example. Divide 10 wives into 30 days. So he has maybe 3 days to spend with you. That is if it's possible to be spending all the night having sex anyway. So possibility of the fact that you might actually be having sex once a month is very high because your husband have like 10 wives. So you are praying. What you are wishing for is just to feel the warmth of your husband. You are not even looking for orgasm. Maybe you don't even know what is orgasm. So what you just want is, let me just feel the warmth of my husband, or let me just make baby. That is not the time to be putting the man hand and say, touch me like this. I want to feel you. Our grandmothers are not doing that. And they suddenly pass these things down to us. So we inherited this conspiracy of silence, this culture of silence as women. And it's a good place to say that the churches are not helping. When people go for pre-marriage counseling, you see them, I see this a lot in my clients saying, oh, it was the church I went to. They keep telling me, whatever your husband wants, especially sex, do not deny him sex. I see men are like animals that does not have capacity to control their urge. And then you are doing marriage counseling, you keep telling the woman, anytime he asks for sex, just give him, just give him, just give him. As if the woman does not have needs. So for a lot of them, you know, they grow up with that, you know, mindset of, I need to satisfy my husband, or I just need to feel the warmth of my husband. So when we move from the, you know, the era of you know, having plenty wives to monogamy, we inherited, or maybe we learned monogamy from the Western world, but we did not learn how to manage that monogamy. So we inherited monogamy, but we are still going on with our culture of silence. So you still cannot tell the man, baby, touch me like this. I mean, I see a lot of women, and probably they find out a particular, you know, position that feels differently. Maybe we'll still talk about that. You know, a position that feels differently and it feels good. And they want to say, babe, I mean, and I tell some of them, like, you know, when you find something like that, just say, babe, it feels so different. Can you stay there? Baby, stay there. It feels good here. And you see a lot of them say, Dr. Tolu, I cannot say it. And I'll be like, you cannot say it. Yes, so. And then for some, they will make effort to say it. It takes a lot of effort for an African woman to even voice out. Maybe even the current generation, they are still having this problem. As long as you are culturally oriented and religiously oriented, you are going to behave this way. So for so many of them, so if they now make effort, they made effort to tell the man, babe, can we try that position? No, the man is so selfish. You want to keep doing that one position that feels good for him. And then the women learn helplessness. And then, but the truth is, a lot of our men are suffering sexually now. You know, what I feel is that the table has turned against the men. Really. Men are suffering sexually, especially the married one. You know, we used to feel, because the women now, they are just there. So all the struggle and all the effort, they're not even ready to make anymore. So let's do it. You want sex? Come and take it. So for a lot of us, so the problem is you don't know yourself. Secondly, you cannot even talk. And then thirdly, when you talk, the man is not even ready to yield, or the man is asking you, where did you learn it from? And then so in most cases, what you are doing is have sex for your husband. What was that question again?
Yeah, I think you answered it in terms of talking openly about it. So if you don't know for
So the
yourself,
question,
yeah,
how do you talk about it?
how do
Yes.
you?
So
Yeah,
how do
yeah,
you talk about it?
yeah.
So I think the first step is understanding yourself.
Mm,
Understand what works for you.
mm,
Understand sensitive spots. Understand the right way you are going to have orgasm. For about 75 to 85% of women, they will not reach orgasm with penile penetration except in certain positions or certain things are done. So if you don't know what works for you, where does he have to touch? How is he supposed to touch it? What kind of position works for me? If you do not know all of that, how do you get it right? So the first point is understanding yourself. The secondly, be bold to say it. I know saying it like that, like I said, it's a bit complicated, especially for someone that has been wired not to talk. Now, so coming out to say it might be a bit difficult, but what women just need to understand is you just have to say it. And I remember, I was having a particular topic sometimes ago, long time ago on my Facebook page, and I was telling women, to talk dirty, so baby, I love what you're doing to me. I can feel you. And then a lot of them were like, if you see my inbox, Dr. Tolu, what are the kind of words I should say? How do I say it? And I'm like, for real? They said they cannot even say the normal one, and then I'm telling them to talk dirty. I was teaching them how to talk dirty. So talking alone is a problem for a lot of African women, not to now talk of even talking dirty. Funny enough, those things that you are running away from are the things that actually stimulate the brain of a man sexually. Men want it. Most of the time, those things that they tell you not to do are the things that they actually want sexually. So at this
mm,
time, be bold, just try. I know it might be difficult, just try to say. Maybe you start saying it gradually. Start small. Maybe before you can now get to the place of, oh, give it to me, baby. I love what you are doing to me. That could be very high for you, but you can just start from, oh, baby, I love that. Just try a little bit. You just have to talk. And then, of course, you can have conversation outside the bedroom. Especially maybe not during the act of love making. You could book a lunch date with him. Take him outside the bedroom and have a conversation. And it could be both ways. Men could also do that for their wife. Because for a lot of us, we feel like a lot of women, especially because I feel a lot of our women have learned helplessness. So like I said, so it has gotten to a point where they feel like love making is being done for the men. So for the men, they feel like, you know what, maybe you want sex. And of course, under normal circumstances, men are going to desire sex more than women. Of course, because the testosterone, the hormone that is responsible for sexual drive, is about 40% higher in men than women. So they are going to desire sex. So for a lot of women, we feel like, you know what, maybe you want sex. Come and take it now. You just give anyhow. It shouldn't be like that. Sex is, like I normally say, should be like a three-course meal. You have your starter, you have the main course, and then you have the dessert. That's how it should be packaged. But for us, how do you package what you are not even enjoying in the first place? So learn to also package it for the man. So if you cannot have the conversation, like I said, it could be both way in the bedroom, take it outside the bedroom and discuss it. Another thing you could do is take his hand or take her hands. Lead. It's difficult for a lot of women to lead when it comes to love making. They cannot lead. They cannot ride their man. They cannot say, you know what? They are having sex and they just lie down there like a log of wood. They cannot take charge. They cannot change position. They cannot stand up, draw the man close and say, they cannot. They're just there. The man is the one making all the efforts. So try. So maybe what you could do is start small, be deliberate and start gradually. You are finding it difficult, schedule an appointment with a sex therapist who can help you so that the two of you, so maybe the starting point might be difficult. So if you talk to a sex therapist could help you, to break the ice. So from there, you can now move on, start on a clean slate.
yes. Oh, sorry. It's okay. Sorry. I was trying to put my plug in. All right. We're back. Yep. Go on. Go on.
I think I'm done with that question.
Yes, yes. So for instance, so women that are asking questions, they have a low libido, and they want to know how, number one, to increase that, and number two, how can they stimulate, what stimulate the female orgasm for women that are experiencing orgasm problems. What can they do to stimulate that?
So for orgasm problem, so there is something that is called the sexual cycle.
Mm-hmm.
So the sexual cycle consists of the desire phase, the arousal phase, and then the orgasm phase, and then the resolution phase. So 4 phases. So if you are having low libido, or you are frigid, or whatever it is, what you need to find out is which of the phases is your problem coming from. That is the first step. Are you having desire problem? Is it that you don't desire that person? You know, I mean, a lot of women have that problem. They get irritated. Maybe the man is not, you know, does not have good hygiene, does not really know how to make love to them. Maybe they've tried and tried, or the man doesn't know. Imagine not knowing how to kiss and being married to a good kisser. I think that is a huge problem in this part of the world. We don't even kiss. And kissing is one way of getting very vulnerable, very intimate. We don't kiss. We think kissing is for Igbo people. For a lot of people, you know, like I normally say, the last time they kissed was when the pastor said you may kiss the bride. And that is it. 2 years, 5 years, 10 years of marriage, no kissing. They say when you kiss and you feel vulnerable, you feel like kissing makes you to be very vulnerable. It makes you to feel like, you know, take me. So for some people, maybe they are trying to kiss that person, and the person, if somebody is a bad kisser, it's a total turn off for somebody who is a good kisser. So if that keeps happening, the person could get to a place of, you know what, no desire. They are not looking forward to it. So if you do not look forward to it, how do you even get to the arousal phase? So find out, maybe your problem is, you know, you are not sexually attracted to that person. You are not feeling the vibe. You know, the person is not turning you on. You don't think of, I mean, there are a lot of people that could think of their man or their woman and start getting wet. As complicated as women's sexuality is, women could get wet just thinking about their partner. A lot of women could have orgasm without touching themselves. Just thinking about or not, maybe a lot of few. So if you don't have the desire, forget around. So the first step is find out which of the phases, you know, you are having this problem. Which of the phases is giving you this headache or this low libido? Now, so if it's arousal, it's easier. So you begin to, I mean, if it's desire, why am I not desiring this person? Is it that I'm no longer in love, I'm not sexually attracted to this person, or this person irritates me, he does not know how to touch me, she doesn't know how to kiss, she just lie down like a log of wood on bed, whatever. So that could be, so find out. Then it could be the arousal phase. So, you know, when we talk about low libido or frigidity or stuff like that, people think it's only the arousal. No, it could actually start from the desire. So if it's the arousal stage, maybe they touch you from now till eternity and you're not getting aroused. So maybe you have the desire. Funny enough, if the desire is there, the arousal phase becomes easier. So, but if you have the desire and you have problem with low libido at the arousal phase, a lot of factors could be responsible. You could be stressed. There could be relationship issues. So what you also need to do is to find out why you are not getting aroused. Like if you find out the cause of the problem, you could be solving like 50% of the problem. So find out, is it that you are having relationship issue? Is it that you are stressed or anxious? Is it that you have been mutilated? A lot of women with female who have undergone female genital mutilation have this problem a lot. Is it that you are having hormonal issue, or you are taking certain medications and you are reacting to them? Could it be menopause issue? You know, so find out. Any of this could be responsible. So when you find out where the problem is coming from, then it becomes very easy to resolve the problem. So if you are the type that, you know what, it's more about, you know, can you touch me the more? So what you could do more is have a conversation with your partner. And that is where communication comes in. Let them know the kind of problem you are having. The same way women struggle with low libido is the same way a lot of men are struggling with erectile issue. So you can tell the man, you know, baby, can you touch me? So spend a lot of time on foreplay. And that's a lot of problem for African men as well. It's a big problem. Because for them, they feel like, you know, sex is more about how long they're able to last. And they just want to penetrate. So penetration is huge for them. They don't want to spend too much time. They've been conditioned not to spend a lot of time. Imagine somebody that have like 10 women to service. And you are telling me to take 20 minutes to prepare you for penetration. I do not have time for that. And like I said, we passed it down from generation to generation. So a lot of women struggle. I mean, a lot of men struggle with foreplay. So they lose their erection if it's taking too much time for them to penetrate. So you might need to talk with your partner and have a partner that can show understanding. Your body is so God is so powerful when it comes to the way the woman body is wired. You have a lot of beauty. This juice is there. You could be secreted if you are touched the right way. So maybe you might need to now talk to your partner. I mean, according to research, it takes a whooping 45 minutes to prepare a woman for penetration. I remember saying somewhere, and the man said, that is first half of football match. You know, so you might need to have a man who understands. Communication is very important. Who could stay with you, who could be gentle with you, who is not selfish, who could take a funny enough, men need to understand that the more you are able to delay before penetration, the longer you are able to last. For a lot of them that are struggling with premature ejaculation, if you can delay, if you can learn start and stop, if you can learn delay style, it's even going to make your penetration to last longer. So if you have a man that can warm you up, you know where to touch, know how to touch, you can actually secrete that juice because they are there. All right. And then if it's medication, so if you find out maybe you are taking certain medications that is messing up with your hormone, you might want to run some tests and probably stop the medication. If it's hormonal, of course there are a lot of physical therapy. I'm talking about like medication that people could use, you know, to help you to boost, you know, like hormonal therapy that medical doctors could do for you that could help you to, you know, probably secrete a bit of more estrogens, you know, that could help you to, you know, to get wet so easily. And of course, you could try lubricants, you know, that could also help, you know. Try lubricant, water-based lubricant preferably, you know, to probably help you. And then if there are tensions, you know, I think, I mean, if you want to really, if you are struggling with low libido, I think vulnerability is a big deal. You should learn to be vulnerable. You should learn to, like, you know, let go, forget all the worries, and just get lost. So if you can reset your brain to also get lost in the euphoria of the moment, I think it can help as well.
Fantastic. I'm quite conscious of the time because I know you've got other things that you need to do. But I wanted to tell people if they want to get in touch with you, you know, to come for counseling, to get some kind of guidance and advice, where can they get hold of you?
So I'm trying to type my website. Okay. So I think that would be the best place to go. Intimacyclinic.org.
Okay.
Intimacyclinic.org. Right.
Fantastic. So anybody that needs to get in touch with Dr. Tolu, that's her website. You can get in touch with her. Does anyone have a question, a burning question that you want to ask her now that she's here? Has anyone got a question? If you have, just put it in the comment box. And the one thing I wanted to ask you also about is your matchmaking website.
Okay.
Because I know
So
there's some single ladies in the house that may want
yeah,
some fixing up as well.
I can put that there.
Okay.
Maybe I will put a number to call as well.
Mm-hmm.
Intimate match. Yeah.
I've got one question, Dr. Tolu.
All right.
Someone's asked what to do when the woman takes sex more seriously than the man. The man has little to no interest.
So, like I said, under normal circumstances, men would desire sex more than women. But a lot of us to be responsible. Imagine a man who have been conditioned in a certain way while growing up, and then got married to a woman who was probably liberal, who could talk about sex while growing up, who could talk about her needs, possibility that she might be, sexually open than the husband is very high. So it's not like maybe the testosterone is not there. It just means that maybe out of conditioning, the woman could have more or a higher drive than the man. So this is where compatibility comes in. So there is need to be sure that, this no sex before marriage. You need to, if you are going to be celibate before marriage, you are better make sure you sit down and talk. If you really have to do that, is your choice, but be sure you know what you are getting into. So what do you do in this situation? You need to, it is the duty, as long as you enter into a marriage agreement with me, so it is your duty to satisfy me sexually. So as long as it's not like you are sick or you are incapable, it's not like you do not have the erection, then you have to find a way to satisfy me. So that is the first thing the man needs to understand, that you know what, there is an agreement here, and it takes two to make it work. So you need to sit up and do your job. Then secondly, there should be compromise. All right, there should be compromise. Maybe she wants it like 5 times a week, for example, and he wants it like maybe 2 times. So maybe she can reduce her own to like 3 times, and then the man increase his own to 3 times. So talking about compromise, just try and look at all the factors and meet yourself, in a common ground or in a common place, so that you can be on the same page. So there should be a little bit of compromise, from here, and a little bit of compromise from there, knowing fully well that, you have role to play, and that's why the first step is very important. That it is my right, it is my duty. I signed a contract to stay with this person for the rest of her life, so I need to do my job. So as soon as that is settled, then there is a desire to make it work, and then the compromise aspect comes in, and then the two of you, can be on the same page, and then I think you will be good. And if you are still struggling with that, maybe you book an appointment with a sex therapist who can help you. Every woman desire an orgasm. Every woman, everybody deserved actually is what I want to say. You deserve to be sexually satisfied. You deserve an orgasm. As a man, as a woman, a sexually fulfilling life is your right. Especially when you are in marriage with that person and you have an agreement, nobody should deny you that right. And nobody should make you to feel like, oh, you're a bad person for desiring it. No, it is your right.
Fantastic. I've got one here, Dr. Tolu says, how do a man know when your partner has reached orgasm? Thank you. How does a man know when the other person has reached orgasm? Because some people fake it.
See, it's very difficult to know who's faking. Especially a lot of African women fake orgasm. Oh gosh, we do it a lot. Because we just want to boost, rub the man ego, make the man feel good. Because we also know that control is huge for them. So we want them to have that control. We give it to them in the bedroom. But funny enough, you know, that ego that you want to rub, it's actually, the man feel it the more when it's genuine. The man feel it, the man can sense it when it's genuine. Because it comes from, you know, it comes out of vulnerability. It looks so real. But of course, because a lot of men too are also used to, you know, a lot of African men, like I said, control is also huge for them. So they don't even know. As long as he's making hoo-ho, fake oohs and ohs, they are good. So how do you know? Consider the way you feel as a man. Consider how you feel when you come. That is a very easy way to know how a woman feels. Meanwhile, women orgasm could actually be more explosive than a man orgasm. So just imagine how you feel. Picture how you are feeling. It's unexplainable, you know, a lot of blood running through your veins, a lot of, you know, tension trying to release, you know. You feel all of that at that moment, you know. Consider when a woman is feeling that. And then, of course, you will sense the wetness. You will sense the wetness. And if you are the type that know how to locate the G-spot, you will notice the sensation at the G-spot as well. And then you will notice the way the vagina clamped the cap of the penis. So these are the signs that you could look out for, the way the vagina clamp the cap of the penis, you know, the signs, you know, the roughness at the G-spot, and then the level of wetness, and then of course the realness in her, the way you feel when you also reach orgasm. So you can use all of that, you know, to judge.
Two more questions and then we'll wrap up. Somebody says, but who can tell the man, since the woman is not conditioned to do so? So if the woman is not conditioned to tell him, who else can tell him?
So I think we've talked about that.
Yeah.
You know, so man, you can actually try and help, you know, make the atmosphere comfortable for her to be able to be and be able to speak up, warm her up to it. You will be shocked at a lot of things she could say. You will be shocked if you can just warm her up gradually. But so that's one thing you could do. And another thing you could do, like I said, is talk to a sex therapist who could help you to break the ice. As soon as you're able to cross that hurdle, then you can move on talking, you know, to yourself.
Yes. And I think it's so important, especially in our culture, for people to actually do see that there's nothing wrong to going to a sex therapist. It actually is very important, because it doesn't only help the sexual aspect of the relationship, it helps the whole relationship, because other things start coming out, you know, out of the conversation. So yeah, definitely, I'm telling you, you need to link up with Dr. Tolu. You need to link up with her. Also, somebody said, can you please announce your new time for your TV and radio program in Nigeria?
Oh, in Nigeria Info, it's 10 p.m. on Saturdays. It's just that, you know, these days I get so busy, and so, but it's still 10 p.m. on Saturdays.
10 p.m. on Saturdays, okay. So it's still 10 p.m. on Saturdays for anyone that is interested. Doctor, has anyone else got a question? Because we're
So I saw a question here.
Yeah. Is there a way to detect when a woman fakes? And I think we answered that question. Is there a way to detect?
Yeah.
Or how can a woman tell if she has been FGM? How could she tell that she's
How could you tell yourself if you have been mutilated?
Yeah.
So female genital mutilation is there are 3 types. There's type 1, type 2, and type 3. So for the type 1, so you have the clitoris and you have the labia. You know, the labia is like the lips of the vagina, right? So for type 1, what they will cut off is the clitoris. So what they will cut off for type 1 is the clitoris. So if you are sensitive to, maybe you find yourself bathing with other women, or you probably stumble on maybe images or porn or whatever, and you can see very fleshy vagina with a protruding clitoris, and you notice that your clitoris is so flat, you know, maybe, you know, that thing is supposed to be like like I think like 4 inches. I'm not so sure about that, you know, but it should be protruded. It's something that you should be able to see. So if your own is so flat and the only thing you can see is the base, somebody don't chop and come out. You know, it's such a very sad situation. And Nigeria has the highest rate of women that are mutilated all over the world. It's crazy. And the only thing female genital mutilation does for you is take away your sensuality. Imagine, you know, the penis, the cap of the penis that is so sensitive like that is made up of 4,000 nerve endings. 4,000. Imagine how sensitive the cap of the penis of a man is. 4,000 nerve endings. The clitoris is made up of 8,000. Double. So double the sensitivity. That is what you are supposed to be getting from your clitoris. And the clitoris is the only organ in your body that does the work of sexual satisfaction. It does nothing than to make you sexually satisfied. So imagine, so if you have been mutilated, your clitoris could be chopped. So you just notice that it's not pointed like the way it's supposed to be. What you are just saying is the base. That's the type 1. For type 2, they will cut off the clitoris and then chop up the lips of the labia. So part of your clitoris, so you're having just the base of the clitoris, and then you are the lip, so you just notice that your vagina is not so fleshy. You know, it's not so fleshy. You know, the lip is not so like the way the lip of the vagina should be. You just notice maybe you just have a very tiny and slim skin. You know, so they chop it left and right. That is, and then they also chop the clitoris. That is type 2. And then for type 3, it's crazy. They will chop off the clitoris, chop off the lip of the labia, and then they will sew it together. So they will sew it together. You have just a small hole for you to pee. That is, so if you want to start having sex, they will now cut it again. And funny enough, they don't even take you to the hospital. So they tell you, for a lot of people, they will now do this, you know, womanhood ceremony for them. They still do it. They do this womanhood ceremony for them and then cut and open up what they saw maybe 25 years ago. Imagine the pain. So for a lot of women, the trauma from that will not even forget sensitivity in that area, forget it for life because of the trauma. So for some people, it's out of the trauma because for some people, it's out of the fact that most of the pleasurable part of, you know, because the things that make women to enjoy sex is actually at the outer side of the vagina, the vulva, because they are made up of nerve ending, and that is where they enjoy. That is why women like a lot of touching, a lot of heading, because the outer part of the vagina is very sensitive because it's made up of nerve endings. So, but because that part, so what they do is remove all those your sensitivity. But the good news is that if you have a man that is caring enough, the base of the clitoris is still there. The clitoris is very long. In fact, it's inside. So as long as it is outside, so it is inside. So the base, even if they have cut it, the root is still there. And pleasure could still come from the root. So if you know how to touch it, even if it's just the tip, the base that is there, if a man knows how to really touch it and pleasure that place, it will make, the woman. So women can still enjoy sex with female genital mutilation, but the man might just need to do more work. Yeah. Very sad situation.
Wow. That's overwhelming.
Yeah, it is.
That's sad.
Seriously.
Dr. Tolu.
Thank you so much for having me, KG.
You don't know how much I really appreciate this. I really appreciate what you just did for me. Thank you so much for coming on.
Thank you.
I know that a lot of people, have appreciated it. A lot of hearts, a lot of people making comments in there. And definitely, please go and follow Dr. Tolu. Link with her on the website. She's got a radio. Somebody asked what channel is it a radio or TV show? They want to know what channel it is in Nigeria.
used to be on TV, but the TV is coming up very soon anyway.
Okay.
But for the radio is on, is
Yeah.
99.3 Nigeria Info. 99.3 Nigeria Info, 10 p.m. on Saturdays.
On Saturdays. And also, if anyone is interested in counseling, you know, the Institute of Counseling Nigeria is there. Very excellent organization. Lecturers are on fire.
Yeah.
You know, I'm a product of it. You know, lecturers are on fire. When I literally, very engaging conversations. I learned so much. And so, yes, also you can check that out. Everybody's saying, thank you, Ma. Thank you so much, Ma. So educative and inspiring, brilliant. I was going to say something else. Just skip my mind. Now, what I was going to ask you, last question is, do you offer therapy for people outside of Nigeria, like virtually, people in the UK, they wanted to contact you? Do you do virtual consultation?
Yeah. I currently have couples in UK. In fact, most of my clients outside the country, I have a lot of clients outside the country, but majority are in the UK. I have a lot of clients there. Of course, we use Zoom for our sessions. And it's been highly productive. For so many of them, you know, like I said, on this, you can't rule out the place of culture and background in therapy. You can relate to that, KG, you know, because we talk a lot about that at the Institute. You know, culture has its impact on therapy. And that is why a lot of Africans, you know, who are living abroad, you know, some of them might have even tried a lot of other people. It's not like they don't know their onions, but, you know, because I still understand the culture, you know, it gives a kind of, you know, different flavor to their sessions. So, of course, yeah, I talk to people outside the country.
Fantastic. Thank you very much, Dr. Tolu. We're going to end it here. Thank you, everybody that turned up today. I appreciate you. Thank you so much. Thank you, Dr. Tolu. Thank you. Bye-bye. We're going to end it now. Thank you. Bye-bye. Bye.